afternoon, everyone. This is Sume Ndumbe-Eyoh, the National Collaborative Center for Determinants of Health. We are on today for the first webinar in the Organizational Capacity for Health Equity Action series. This is entitled The Anatomy of a Health Equity-Oriented Organization, Insights into Organizational Capacity. As a reminder, today's webinar is being recorded and will be available for viewing or listening on the NCCDH website. Our facilitators today are myself, Ndumbe-Eyoh. I work with the NCCDH as a Senior Knowledge Translation Specialist. Also joining me is my colleague, Asha Kortete, who works with the Center as a Knowledge Translation Coordinator. So the NCCDH, your host for today's webinar, is located in Mahi, which is the ancestral and unceded territory of the Mi'kmaq people. Our host institution is the St. Francis Xavier University. And I offered this acknowledgement today as a way to signal Indigenous resistance, which has been ongoing, and to recognize the relationship Indigenous peoples have had with this land. I am a Black woman. Today, this month is Black History Month, so I've been spending some time thinking about anti-Blackness and settler colonialism and what that means for how I personally do my work, particularly around health equity. For folks interested in some of my very early thinking about that, you can check out a blog I wrote on our website. So at the NCCDH, our focus is on working with public health practitioners, researchers, and decision makers to really try and identify and share what we know about what we know, what works to close the gaps in health outcome and also to reduce the social gradient in health. And we do so through webinars like today and also through resources on our site. The NCCDH is part of a network of five other NCCs, and together we form the National Collaborative Centers for Public Health. We're located across the country, and each NCC has a different focus. So we have NCCs looking at issues around Aboriginal health, environmental health, methods and tools, for knowledge translation, infectious diseases, and healthy public policy. And if you'd like to learn about any of those centers, you can access all of them through the main NCCPH site, nccph.ca. So I see folks already introducing themselves in the chat box, so please do continue to do so. Throughout the course of the webinar, if you do have any questions or comments for the presenters, you can drop them in that chat box. I will also encourage you all to share any resources that you have found to be relevant in your work related to this topic, so thanks for that in advance. So speaking of today's webinar, we're going to spend the time we have here today really thinking about organizational capacity for health equity. And we're going to be sharing with you some of the work we've been doing at the center to explore and address this issue. So more specifically, myself and our guest speakers today are going to be discussing barriers and challenges to organizational capacity for health equity. I'm going to give you a brief overview of the initiative and the approach we're using, which is, in a sense, the NCCDH's response to some of the needs in the field around organizational capacity. And in doing so, I'll speak a little bit about what that actually means for public health organizations. So that's where that whole idea of the anatomy comes in. So what components organizations need to keep in mind as they think about capacity to address health equity. We'll also touch briefly on the need to address organizational change at multiple levels and give you a sense of how organizations in the field, particularly through the example of Ottawa Public Health and Interior Health, are trying to apply these change principles and ideas in a very real world context. So it's a real pleasure today to have a number of the members of the Learning Circle joining us, and I'll introduce them briefly in a few minutes. But before we go any further, I just want to have a common working definition for us. And so when we're talking about organizational capacity for health equity action, we've really been drawing on the definition Dr. Cohen, who's on the line, and other colleagues put forward, which is the ability of public health organizations to identify health inequities, mobilize the resources required to address them, and then to take effective action. And for capacity building broadly, we're really thinking about the development of knowledge, skills, commitment, structures, systems, and leadership. And I think the structure, systems, and leadership piece is where, as a sector or as a field, we really need to be paying a lot of attention to. And I think when you hear our presenters today speak, you really hear all of them, I think, consistently emphasize the importance of paying attention to not just staff knowledge and skill, but also to the context in which people do their everyday health equity and public health work. So I'd like to stop here and welcome and introduce our 4 speakers for today. So Dr. Pauly is a professor in the School of Nursing at the University of Victoria and a scientist of the Canadian Institute for Substance Use Research. She's the nominated principal investigator for the Equity Lens in Public Health project, which is ELPH, and is leading research on the application of health equity in public health systems in BC. She's currently the Island Health Scholar in Residence and a University of Victoria Community Engaged Scholar. Thanks for joining us today, Bernie. So, our second speaker for the day is Dr. Sharon, who is a Michael Smith Foundation for Health Research postdoctoral fellow with the ELPH project, so she works very closely with Bernie and that team, at the Canadian Institute for Substance Use Research. And Sana is also an embedded health equity scholar at Interior Health and a member of the NCCDH Advisory Board. Sana will be speaking to us today about some of the work Interior Health has been doing as part of this project. Also joining us on the line is Tania Connor, who is with Ottawa Public Health. Tania works with Ottawa Public Health as a public health nurse with the health planning and organizational best practices team, where she's providing departmental support to operational planning, risk and compliance management, prevention reporting, as well as quality improvement. And Tania has a background in community health nursing and has worked in a whole host of different public health program areas. Today, Tania is going to be speaking about Ottawa's work as part of this initiative. Our 4th guest speaker for today is Dr. Benita Cohen, and Dr. Cohen is an associate professor in the College of Nursing at the University of Manitoba in Winnipeg. Her focus is on strengthening the integration of an equity and social justice lens in public health, education, research, policy, and practice. Dr. Cohen led the development of a conceptual framework of organizational capacity for public health equity action, and the definition I cited earlier is from some of her work, as well as the development of indicators for health equity work in Ontario public health agencies. So Bernie, Sana, Tania, Benita, thank you for joining us on the call today. All 4 guest speakers are members of the Learning Circle, so it's a real pleasure to have you on today. Bernie, Sana, and Tania are going to present, and Benita is going to come in with some reflections and thoughts during the Q&A session. So please, if you have questions for any of our speakers, do drop them in the chat box. So before we get started, I want just to get a sense from people on the line, in your experience, what enables organizational capacity for health equity? So please start to drop your responses in the chat box, and we'll take a look at that as we go through today's conversation. So we're really interested, from your perspective, what supports and what enables organizational capacity for health equity.